Well, that was very, very interesting, Peter. Some of those slides were quite astounding, especially the ones that we saw where sound formation was almost exactly a duplicate of the cellular formation. There's also a film that you have made with Dr. Hans Jenny on this material, is it not true?
That's correct. I think if you see the actual film on it, it gives you a better concept and a better idea of how these shapes and forms can move. In some parts of the film, it looks almost as if it's a living, moving amoeba that's existing there. But all of it owes its life wholly, solely, and simply to sound. You stop the sound and everything stops. You turn on the sound and everything becomes alive. It looks like living shape and form.
Wasn't there something in the Bible? In the beginning was the Word. I'm talking about the Word maybe meaning sound or something like that?
Oh, yes, we love to use that one. In the beginning was the Word, and the Word was God. Well, I read this many times as a child and it didn't make much sense to me. I quite admit it was interesting, but it didn't have much sense. But what we didn't realize, and we didn't realize until comparatively recently, is that within this we have a scientific formula. So if we turn it into the modern idiom, into the great voids of space, sound caused matter to take shape, because it's basically what it does. You can take any matter, what you like, whether it's a liquid, whether it's oil, whether it's dust, whether it's sand, whatever it is, and you can form it into the most intricate and fascinating designs and patterns and shapes and forms. But you see, most of this work, the basic work, we have followed it up, it's true, was done by Dr. Hans Jenny. But this, medically speaking, was not what we wanted. What we needed was a harmonic that would form not into a flat shape. You see, most of these are flat shapes on the plate. We wanted something that would form into a three-dimensional form and shape, something that would defy gravity, if you like, in which we had injected levitation. Well, when I first went into the laboratory and asked my technician if he could formulate some way in which we could create levitation, he thought I'd go and start raving mad, and said, well, that's impossible. But anyhow, from single frequencies, we tried 2 frequencies, 3 frequencies, 4 frequencies, and the patterns become more intriguing, they became different, they become, if I may dare use this word, may become almost ethereal, because they become very fine and delicate, but it still wasn't what we were after. And we were almost at the point of giving up when we said, well, we'll try one more, we'll try 5. And when we tried 5 frequencies, we nearly jumped up in the air, because it actually happened. The stuff that we had on the plate literally blew off the plate. So what we did then was to put a plastic, which we thought we could bind and hold together, and we put this plastic on the plate, and sure enough it formed itself up into a form defying the pull of gravity, and started to form up into a holistic form and shape, three-dimensional. This is what we needed, this is what we wanted, because this is the basic sort of formulative structure of shape and form in the human body. So we were really onto something there.
So in a way, then the sound creates the form.
The sound will create the form and will hold it for just as long as you want it to hold. But if you change that frequency, then it will, if you want to use a word, you will have mutation. You will change the shape. So therefore it is again correct to say, scientific fact, that as the sound, so the shape and the form. So there basically we conclude from that the human body in the form in which we see it is held in that formulative pattern and structure wholly and solely by the sound it contains and makes.
Peter, could you tell us a little bit about the use of cymatic therapy in hospitals and other clinical settings? Is it being used in hospitals today?
Oh yes, most certainly. Mostly into the smaller consulting rooms. It seems to be more an individual thing rather than a collective thing in some of the large hospitals. But in the smaller establishments, in consulting rooms and clinics, it's proved absolutely invaluable. So many of the conditions especially simple things like, as I say, simple to the practitioner but difficult to the person who's receiving it, and that is slip disc, which can be horribly painful, can keep people away from their work or their offices or their employment for sometimes weeks on end. There's very little that can be done about it except tell them to rest, and that's about it, and give them a painkiller. Well, now with the aid of Cymatics, all this can change. We can alter all this. With the application of Cymatic therapy for approximately 10 to 15 minutes, the pain will ease down considerably. And invariably, when the tension is moved out of the surrounding area and tissue, very often, without manipulation, it will slip back in place. But even if a manipulation has to take place, it can be done easily and simply. Therefore, the older technique of osteopathic manipulation, which has been the, shall I say, the arguing point between the medical profession and the osteopaths, especially in the UK for so long, is now overcome. No longer do we have to, what we term a cold manipulation, in other words, force it back into position, because once you've used Cymatic on, the whole area relaxes, eases, and it will be comfortably back in position. Now, there are many other things that we can ease and relieve pain without the administering of drugs and painkillers. It has been found and checked by specialists in London who are using this instrument that the endorphins, which are the secretion from the brain, which ease off pain, it's like nature's painkiller, is activated by the transmission of frequencies into the structure. We have used this in hospitals where patients have been injured in mining disasters where the roof has crashed in. Now, we all know medically there's very little we can do from this, or except to clean it up, make them comfortable, and give them a painkiller if necessary, and just hope that time will heal it. Well, now we can do much more than that, because for applying this frequency above the damaged area, we can deaden down to a large extent the pain, and there is no side effects as if we have given drugs to administer it.
Have you tried this in the situations of cancer, for instance?
Well, now, cancer is something which unless you are an MD, you are not allowed to treat. We've got to remember that these instruments are in the hands of osteopaths, chiropractors, nurses, nurse consultants, all these kind of people who are efficient practitioners within their own rights, and they are using these instruments. Now, with this instrument, they are not breaking the law in any way, shape, or form, because we do not deal with cancer to obliterate it. We do not attempt to disintegrate the cancer. We treat the organ to which it is being troublesome. In other words, if it's a lung cancer, we treat the lung. We strengthen and fortify the lung and let the cancer take care of itself, and invariably this does happen.
Dr. Manners, I know you brought your Cymatic instrument here from England. Do you think you can show us how it works?
Yes, we can do that. That presents no problem now. In its early stages, of course, it was a vast instrument which was very clumsy, very difficult, and couldn't be moved. Now it is transportable, it's no larger than a large attache case, and we can utilize it in homes, or hospitals, clinics, nursing homes, consulting rooms. It can be carried by the practitioner or the doctor wherever you would like to use it.
Ah, splendid, splendid. We have Priscilla King, a nurse consultant here who has volunteered to act as a patient in this situation. I guess she'll take a little time off from her nursing patients to help and act as a patient. So why don't we bring Priscilla up here, and she will be happy to let you work on her with your Cymatic instrument.
Yes, we'd be most happy to do this, but at this point we must add that we shall only be able to use the applicator unit for this form of treatment. There is another form of treatment which is applied from the same instrument, which has become known as biocymatics. Now, biocymatics is using silent sound. There is no sound whatsoever. You're using the basic energy out of the sound, but in order to use this, you need the patient definitely in the clinic, because saline solution and pads have to be used for its application. If I might explain how this functions, if a patient has, what should I say, normal mobility in arms and legs, very often if they hear music or a beat in music, they will beat in time with it, either with a hand or with a foot. It's a very common occurrence. It's a very complicated thing if you run through all the procedures of it, but it's quite easy to do. But if there is paralysis or anything of that type within either the arm or the leg, the limb will not do it. Now, it won't do it because the left hemisphere of the brain is closed down on the synapse and it can't actually function it. But all the muscles may be correct, the nerves may be all right, joints, bones, everything is in order, but the synapse of the brain doesn't function the limb. Now, if we reverse the process of the cymatic input and put the input in through the hand and the arm, we can then re-establish a movement in that arm. And we can get the arm to beat in a normal, natural way. But that's not the end of the story. We can do that, and we've been able to do this for quite a number of years. Oh, it exercises the muscles, and it's very good, and it's quite interesting to the patient to be able to see a paralyzed arm moving and beating time. But that is not basically what we want. What we want is the synapse within the brain to start to activate this movement. Now, previously, it was extremely difficult to, shall we say, go into another dimension of healing with the ordinary medical profession. But of course, we're in more enlightened times now, and we can do this. So what we tell the patient is to close their eyes, to visualize on the paralyzed limb, see it in their mind or their mind's eye, and then as the impulse travels into the limb, to mentally lift at the same time. If they do this, then the synapse will start to function and we can get movement back into the tissue and the structure again.
Sorry we won't be able to see that aspect of the instrument being utilized, but I'm sure we will have an extraordinary experience watching this.
The instrument is so designed to make it as simple for operation as we possibly can. On this side of the instrument is a sonic computer which will formulate the basic frequencies that you require for treatment. This can be then locked into the mind of it, transferred and recorded to a magnetic tape, and it is then ready when you plug in your applicator on this side to apply to the patient. And the way we apply it to the patient is merely to switch it on and turn up the amount of output on the applicator. The applicator is then applied to the patient, but before it is applied to the patient, it's always advisable, remember we're interested in holistic medicine, and the patient is an individual, not a case. The patient is very often apprehensive, tense, perhaps tired and in pain. And we firmly believe that an application of your hand over the area first, before any treatment is given, has a soothing effect, beneficial effect, and the patient feels more confident. Then apply the frequency field. Now, the frequency field that you're applying, immediately it is applied, the patient will relax automatically. As you're coming to the patient, they're a little apprehensive. Once it is applied, they're perfectly content, easy, and relaxed, because the frequency you're filling in is entirely in relation to the natural frequency there. You are using a natural frequency. There is nothing injurious, nothing harmful, nothing that will do any harm at all. In this particular case, our nurse here hasn't any serious problems, but had she had serious problems and this joint was unmovable, a small application around the joint structure would ease down the tension, and after a few manipulations by the applicator, you would be able to gently move the joint without pain or discomfort. Up in the area here, which is always an area of congestion, pain and discomfort. Remember, this is a very important area of the body because your eyes are controlled from here, the organ of balance is controlled from here, the facial muscles are controlled from here, and also the nerve going down the arm is all controlled from this area. It's a place where tension builds considerably. So therefore, by applying this over the area, you get a relaxed and comfortable feeling. Once the applicator is in contact with the patient, you have no further need to comfort or to reassure them. And it matters little whether it is a young baby, a small child, or whether it's an elderly patient. All of them relax, and it's easy, pleasant, and comfortable. The frequency field that you are actually hearing is the sound which exists within muscle structure. That sound that you can hear is the actual sound that is contained within the muscle structure, amplified many, many thousands of times. And therefore, all that is necessary is to apply it over the area for ease, comfort, and relaxation. If they have come in and complained to you that there is pain in that shoulder and it's possibly rheumatism, they've not told you anything else perhaps, and you are treating this, they will very often say, "Doctor, I can feel something happening down in my knee." Now, the reason for this being that there's possibly a slight rheumatic condition in the knee joint, which they haven't necessarily told you about, but because the frequency field is traveling into the system, the whole system is consumed with it all the way around, and it will find any weakness anywhere in the body and deal with it as you're dealing with this area here. After you've done that for a little, if you are an osteopath or an orthopedic surgeon, then you can start to move. The area will move easily, it will relax. If you're going to move the arm joint, you'll find that you'll be able to move it easily and simply, and you will find the muscles will relax. How does that feel?
Very good. As you put that on me, I felt my whole body start to relax.
You can feel it all around the body.
Yes.
That's right, yes, because it's transmitting into the whole of the structure of the body. You see.
Now that you have got the Cymatic instrument pretty well developed, you've had it for a number of years now and have been using it successfully, what are you doing now in terms of new frontiers of using sound?
Quite a lot, a considerable amount. The instrument itself is fully developed. It's scientifically acceptable, it's medically approved, and we now have these instruments literally all over the world in use. Particularly in the third world countries where we're able to train people efficiently and quickly to use the instrument. But our research field at the present moment is stepping now into light therapy, which is becoming known as chromatology. It was always previously thought that the effect of colored lights, as they termed it, was a kind of gimmick. In which you sat under a pretty light and it was very comfortable and it was very nice and very warm and very relaxing. Well, I'm afraid all that is now completely changed. We do know that light penetration can penetrate through the pores of the skin, it can affect the bloodstream, it can affect internal organs, it can do a considerable amount. We advocated many years ago that babies born with the bilirubin, which is yellow jaundice, should be treated, instead of blood transfusions and drugs, should be treated under blue radiation. This was very suspect for a long, long time, until one doctor in the United States tried it, used it, found it successful, and now this technique of treating bilirubin is used all over the world now.
So you're working with color, what else?
We're working with color, but we're also working with the action of the brain. We find that if we use these frequency fields, we can affect the left and right hemisphere of the brain, and we feel that very often a condition which causes paralysis or a problem in the human anatomy and structure has its seat in the left side of the brain. If we could only stimulate the right to sort of assist, take over, or form a bridge between the two, we could overcome a lot of problems. Well, now with the advent of sound in a new dimension, we're able to do just this. And our research now is into using headphones which feed different frequencies into the structure in the system, also applied at the same time as light radiations and cymatic frequencies. We're able to activate all the cell tissues and nerve ganglia within the body, and we're getting very, very good results. And it won't be long before we're able to discuss this and explain these details to you.
Wonderful. I look forward to hearing about those at a further date. If people are interested in trying to find out more about cymatic therapy, Peter, how do they reach you?
If they write to us, Dr. Manners, the Brett Fortin, BRETFORTON, Brett Fortin Hall, HALL, Clinic, Brett Fortin, Vale of Evesham, EVESHAM, Vale of Evesham, Worcestershire, England. We will attempt to answer every letter, if I possibly can, personally.
And this is also how they would get a cymatic instrument or information on the cymatic instrument, of course.
We also train students at our clinic so that we can qualify them in the use of cymatic therapy.
And in the United States, those of you who would like to contact me regarding various uses of sound and music for well-being,
SHA, the Sound Healers Association, may be reached by writing Post Office Box 2240, Boulder, Colorado, 80306.
we continue to work with Dr. Manners, and we are very, very grateful for having had him here tonight. We hope that the information which we've disseminated has been of use. We thank you, Dr. Manners, so
Thank you,
very much.
Johnson. I've thoroughly enjoyed being here.
It's a pleasure here, too. Thank you.